right, hello everyone and welcome. Thank you for attending today's webinar with Fullscript and Katie Chapman. My name's Kaylee. I am part of the Fullscript marketing team and we're very excited to have Katie here as she talks about bariatric surgery from a supplements viewpoint, among many other things. But before we hear from her, I have a couple housekeeping items. This reminder that this webinar is being recorded. So everyone who registered will get access to the recording and any other resources we can provide, as well as the webinar lives on fullscript.com/webinar. So you can find it there as well. And we are hoping to have some time for a live Q&A towards the end of the presentation. So on your GoToWebinar dashboard, you'll see a question section and a chat section. Add your questions in there. I'm going to monitor them on the back end and we'll get to them towards the end of the presentation. So yes, I'm very happy to introduce Katie Chapman today. Katie is an award-winning registered dietitian nutritionist specializing in bariatric nutrition, GI issues, and hormonal health, and has over 10 years of hands-on clinical experience. For the past several years, she has been working with industry partners and consumers to improve nutrition education within the field and also maintain a virtual private practice. In April 2021, too, she launched Bariatric Nutrition Pro to provide healthcare practitioners education to start or continue their bariatric career with the confidence and knowledge to succeed. So I could go on and on about the awards and the positions that you hold, Katie, but I'm going to pass it over to you to start the presentation, and I'll rejoin you at the end towards the Q&A.
Thank you so much. And gosh, I'm happy to join Fullscript today on this subject that is kind of near and dear to my heart because I've just spent so much time in this field and have seen people go through surgery from, right at the beginning all the way to years and years afterwards. I even have a client that's 20 years out from surgery. So I kind of know or get to know all the ins and outs and uniqueness of bariatric surgery. So what I wanted to do today was kind of get a really good understanding of bariatric surgery just as a whole, and then also go through some of the vitamin and mineral considerations, because that is something to be thought of with bariatric surgery, but also for those of you that this isn't your main kind of subject matter, just what to look for. And then also at the same time too, what additional things should we think of? What in practice do I see, do I find or discover? And so I wanted to kind of pop all that in here today with Fullscript and how you can utilize Fullscript in the assistance with these clients. So, of course, in this webinar, surgery, nutrients, supplement considerations, and then even some of the other tools that I use to further personalize supplements. So here we go. Let's talk surgery. So first and foremost, obesity as a whole is a multifactorial disease. So it is brought on by many parts of this picture. So it might be medical, medications, endocrine system disruption, environment, even our genetics and epigenetics, and then cognitive, neurobehavioral, and even our immune environment. And sometimes it's several of these, sometimes it's all of these, but it's just a multifactorial disease. So in approaching obesity, I have to think of it also as a whole. And as a registered dietitian, of course, my first and foremost thought is the food part of the picture. But I also want to think of these other factors involved as well, and how can I help to support or change them in any way. So surgery is a part, or could be a part, of helping this obesity picture. So just a quick overview of bariatric surgery. I put up here just some of the guidelines from NIH of someone who would be eligible for bariatric surgery. There might be some nuances to this, but these are the main kind of guidance or guidelines. And then I put up a picture of an example of a bariatric surgery. This is the Roux-en-Y gastric bypass, which oftentimes people do hear about, usually gastric bypass or sleeve gastrectomy, but there's a myriad of bariatric surgeries. And that might be important for me to know when I'm working with someone, what type of surgery have they had or are they going to have? And so that way I can approach them with maybe vitamin and mineral needs, or approach them with other supplement needs that might need to happen because of that surgery. So let's go through surgery themselves. I kind of split them out into different pieces here. So first we have our metabolic surgeries, which used to kind of be more commonly called malabsorptive surgeries. And that includes the Roux-en-Y gastric bypass. And then there's some other ones too, pancreatic diversion, duodenal switch, and then a SABI procedure. That's a relatively newer procedure. And then our anatomical surgeries, which were called more restrictive surgeries, and that could include sleeve gastrectomy or an adjustable gastric band. Again, nuances to those, but we like categories, so this just helps to guide of what I'm looking at or looking for. And then we have endoscopic type of surgery. So these could be a gastric balloon or a space occupying device, something of that sort. So it's good to kind of know which categories or which category you are working with in order to kind of properly navigate your client. I could talk days about just this, and I'm hoping that this webinar just gives this great big overview of what are some of the things as a practitioner I kind of consider as I'm along this way of bariatric surgery with someone. So one of the main things that is thought of with surgery is micronutrient deficiencies, and there is a prevalence of that after bariatric surgery. And so just some signs and symptoms that I can say that I see with micronutrient deficiencies, and then some general causes of those, and just baseline that you think of with surgery. There could be a change in absorption or a change in anatomy of where something absorbs, maybe acid production changes, whether that's surgery related or if someone has to be on a proton pump inhibitor after surgery. So a lot of factors in this. And I think what's difficult is a lot of those signs and symptoms are pretty common in life. So you're not always quite sure, is it coming from a micronutrient deficiency? Is it something more? Is it just, other just kind of life factors? And so I always want to make sure that my micronutrients or my vitamins are first and foremost baseline, that I'm covering my bases there. So just to kind of give more context of why we see micronutrient deficiencies after surgery, where we're looking at this picture shows us our whole kind of digestive tract, and where I like to call kind of where the magic happens in terms of vitamin and mineral absorption. It's it's a kind of happens along the whole entire digestive tract, but there's definitely this point of where most of our nutrients are absorbed or utilized or broken down. And so in that shaded area that you see here, that's actually where, example of a Roux-en-Y gastric bypass, where that bypass would happen. So as you can see, we have a lot less area for where that magic could happen and where that absorption can happen. Our digestion and our bodies are amazing at adapting, but we're still not going to get in the full picture. So we kind of need to make sure that we add more opportunity and more vitamins, minerals, or from the just food, let's say, in order to make sure that we guarantee that absorption can happen in other areas, more opportunities for those vitamins and minerals to be picked up throughout the digestive tract. You can tell I talk with my hands so much, so you'll see those probably appearing throughout this talk too. So micronutrient prevalence of deficiency after surgery. This is why I think when I look at it, I'm kind of like, oh, okay, yeah, no, I need to make sure that I have a vitamin and mineral that covers my bases here. And because there is just that prevalence of deficiency after surgery. And you can see there's quite a bit of range in there. And there's also quite a bit of just even like up to 65% for folate. So I I really want to make sure that, again, I think through this on just a vitamin and mineral level, but then also what else does the body need too? So I put in here a couple of reasons and some of the main ones that we tend to see go low after surgery, and just some of the reasons of why that may be. So we could think through maybe a different format of vitamin, or possibly if it's a carrier or let's say endocrine disruption, we might have to also add that piece as practitioners into that picture. So let me talk through supplement considerations and just what I might even add or what I might even consider. So for micronutrients after surgery, just I wanted to just put out there what is the recommendation and if there is any differences for each type of surgery. And so I put that here. This comes from ASMBS, the American Society for Metabolic and Bariatric Surgery. And so it gives us some base recommendations and then maybe some nuances depending upon some of the major types of surgery at the time that this was written. I like to use this because I like to make sure if I'm recommending anything, it covers my bases. And that part is like, whew, good, okay, cool. I'm not concerned about these being deficient or the potential for these being deficient. Now, some vitamin regimens that people go by to cover those bases, and oftentimes this is coming from where they had surgery. So there's certain, they might have a bariatric formulated vitamin that they carry or they use or that they formulated. And within that bariatric regimen, they actually have a multivitamin that usually covers all the bases or are like high enough for those ASMBS recommendations. And then separately would be a calcium citrate. There's also non-bariatric formulated regimens, which can get to be for a lot of people quite overwhelming because then you're kind of separating out these individual vitamins. Fullscript has some that I can say do have higher doses of some of like the B vitamins and vitamin D, and then one would be like a pure encapsulations. They're one multivitamin. But I still have to consider it like a non-bariatric formulated regimen and then add some things to it to make sure all those bases are filled. So what I want to do with my vitamins and minerals is I do want to monitor them so I can tweak along the way. I have some people that do great with a bariatric formulated multivitamin, and then they have a really, really tough time with absorption of, let's say, B12. And maybe I need to think through that and get them more of like a methyl cobalamin or something like that. And so that's where kind of lab monitoring along the way really helps for you to personalize and customize these. So I just put what my suggestions would be up here. And I think you guys get these slides. So I know some of the information in here is really helpful in just having that too. So I, want to switch gears and also think through, well, what are the other things that I usually have as part of this picture? What are the other parts that I definitely utilize Fullscript for? And then also at the same time, it's more than just vitamins. So let's go through some of my main ones here. So first of all, I would say probiotics. So that's something that I usually will have someone start about 6 months to a year after surgery. And the reason being is because there is so much happening in terms of healing and getting in, my vitamins and minerals, and also advancing nutrition-wise, that I hold off a little bit on probiotics right there at the beginning. Some of the things that I think of is I want a multi-strain probiotic, and one that also potentially could include Saccharomyces boulardii. That's actually a yeast, but it is categorized as a probiotic, and it helps to really strengthen that gut lining wall. And so, I'm usually looking for a nice lactobacillus, bifidobacterium, Saccharomyces boulardii in combination, or even just separate of those. So I'll talk more. I'm going to talk gut health a little bit more later. So I'll circle back on these and when I talk about gut health. The other thing that I think about is inositol. So inositol is a nutrient that is found within many of our foods, and it acts kind of like a B vitamin. Oftentimes people call it kind of a B vitamin adjacent, and it helps to stabilize the insulin response within a cell. So I think about inositol as being like, if I have insulin resistance and my cell is kind of closed, inositol helps to open that cell, so then I just have a better stabilized insulin and blood sugar control. I definitely think about this in terms of bariatric surgery because of still working with blood sugars. Even though surgery really, really helps to stabilize insulin after surgery, if someone has had unstable blood sugars for many, many years of their life, surgery does help and assist with that, but we actually might need to take a closer look on a cellular level to assist with inositol to do that. And so, some things to be aware of. I do look at the ratio. I do look at kind of some of the supplementation, and if it's a pill form versus a powder form. The Now Foods powder form of inositol actually is a really, let's say, good tasting one, which I can see that's available, but there's quite a few inositols available too on there. So that's a consideration that I might add into this picture. The other one is something that helps for sleep. So if I'm thinking through this and I'm trying to help someone recover after bariatric surgery, I'm also wanting to help continue maybe weight loss, or just help to assist. Sleep is something that's so crucial to help someone with their weight loss. Lack of sleep usually ups blood sugar, ups hypertension, also usually ups someone's calorie consumption too, just because the body doesn't have a nice rest, repair, overnight action. So when I couple of supplements that are at least ingredients, let's say, that I think through is valerian root and a lemon balm, and those help to calm the nervous system and calm restlessness. So I oftentimes will hear from people, oh, I fall asleep okay, but then I like wake up during the middle of the night, or I'm kind of restless during the night. And so something like this, like a valerian, might really help with that restlessness overnight, that can lead to more robust sleep and sleep maintenance. So then just a couple things to consider or be aware of as you're working with herbals and working with supplements is just look at the whole picture. If someone is on a medication such as a thyroid medication, then making sure that that's a significant amount away from that thyroid medication. I'm usually looking for 4 hours, but it's something to just kind of take take heed to, so you're not having interactions that could be then detrimental to that medication. Another supplement I'm thinking through. Inflammation. So what can I do to help with inflammation? So when obesity as a whole is considered an inflammatory disease, it does have chronic inflammation involved with it. And so I'm also just trying to look, as I have someone go through bariatric surgery, whether it's before surgery or even after surgery, I'm wanting to help reduce that chronic inflammation that someone has been existing in because of their obesity. And so I think of turmeric and boswellia for both of their anti-inflammatory effects, and also to assist in some other ailments too as well. So again, what to be aware of, I always like to put in some kind of thoughts in there, just because I think supplements are so useful, but something that can be very, you have to be kind of really thoughtful, I guess, in how you are advising, prescribing, or even navigating this. So I know even some of my clients want for me to kind of spell out, like, okay, when do I take this? When do I do this? So that way they're not having any sort of interactions with anything, or if there's like a concern of missing it too, that schedule kind of helps again as well. Okay, omega-3 fatty acids. It's another one that I might add into the picture. So with omega-3 fatty acids, yes, it helps with cardiovascular health overall, improves kind of that insulin resistance. And so I'm just thinking through as a whole with that separate like supplementation. I'm thinking for cardiovascular health, brain health, and then also it is helpful as well for gut health, and also for inflammation too. So this one I typically add, or if someone is more of a fish eater, then I want to advise them for their more fattier fish, and then look for a supplement that is smaller fish for a little bit less mercury, but also at the same time has that robust omega-3 fatty acids. What am I looking for? I'm usually looking for a ratio of kind of like 2 to 1, so 2 EPA to 1 DHA. And most supplements are coming typically in 1,000 milligrams to 2,000 milligrams. There's no ideal kind of like CDC or any guidelines in terms of this is exactly how much that you need or use, but that's typically what is seen in supplementation. So I'm kind of going, gosh, okay, do I want to add this in? Do I want to make sure that I use this for insulin resistance and insulin control, along with inositol? And so what I might do, I know that I talked through quite a few other supplements or food for thought for this, is I want to make sure that I'm personalizing this. So if someone is a wonderful, well-rounded sleeper, then that might not be a consideration for me. But if they've had obesity for 10 or more years, then I may want to think through the inflammatory effect or the inflammatory part, and help with that. And also potentially help with insulin resistance as well, if that's part of their picture. So the picking and choosing of this tends to be really important, so I don't constantly overload someone with supplementation, but also am thoughtful of what's going to get me the most kind of bang for my buck per se. So other tools that I may think about or utilize, or kind of, let's say on a functional medicine sense, what do I use if I'm really trying to personalize within bariatric surgery. So as I said at the beginning, one, I always take a look at what type of surgery did they have. If it's something more on the metabolic end, which tends to have more rerouting or bypassing of the intestines, then I may really, really be thinking through, do I need to look more at optimizing their gut health in order to make sure absorption goes well and happens? And because when you're doing a surgery on someone's intestines, it's kind of like you're taking their house, you're shaking it, and then you're dropping it down and hoping all of those kind of gut microbiome or gut microbes go to the right spot. But there's definitely that point of time where, right, if you shook up that house, you're trying to put furniture back in its spot, you're trying to make it look to where it needs or wants to look as it was before. If I'm thinking through maybe some of my more just like anatomical or restrictive ones, gosh, I might think through just, are they taking things as someone should? Are they taking their micronutrients and their vitamins on a consistent basis? Because oftentimes, because their surgery didn't feel like so much of a surgery, and I say that very compassionately but lightly, that someone might think, oh gosh, I don't need those micronutrients. And in truth, with less food going in there and potentially just change and kind of how something's, the timing of how something goes through that digestive tract, I might think through of, oh, what do I need to do micronutrient wise, or making sure someone's on micronutrients. And then from there, do I need to think through like gut health, or do I need to think through of cellular function of how they use those vitamins? So some of the kind of, let's say the type of surgery, and then what would I think through to help make my supplements or help make me recommend supplements in a little bit more unique way and just personalized for them. So what other tools do I maybe use or think through or talk about to personalize those supplements? First, of course, I always consider a person in their life, and do they like to take supplements, or do I need to think about liquid or powder or what format? But what am I looking on a deep kind of clinical level here? So I want to talk first just hair shedding, because this is one of the main things that is talked about with surgery, but also is such a concern for people when they're going through this process. So hair shedding, and especially seen within the surgical sense, is it's actually properly called kind of telogen effluvium. So and basically it's that temporary hair loss following kind of an event. So how I put this to patients or clients is, surgery one is it's a stress, like it's an event for our bodies. That's one. And then two, afterwards, because of that healing process, you're very low calories at first, and then you're gradually adding in calories along the way. And so there's a lot of effort that the body is doing, especially at the beginning. And so our bodies don't need hair. We may need hair, but our bodies don't need hair. And so it's putting all of its limited resources towards breathing and having our heartbeat and having our digestive tracts work. And so it doesn't put effort into that hair regrowth process for a temporary amount of time. But what do I think about when I'm just assessing this? Is if hair shedding is happening with my client following a bariatric surgery, is there's something that I want to think through or potentially utilize on a supplement sense to help in the meantime. So where to start? One, I usually see hair loss typically around 2 to 3 months post-surgery, and then regrowth starting 6 to 7 months after surgery. So they might just be in that point of time. But I also want to just cover my bases. What multivitamin are they using? Is it covering my ASMBS guidelines? Is it consistent? Are they taking it daily, or do they kind of take it when they remember, and they remember every other week? That's some, gives me some insight or some clue. I also want to look at my iron, zinc, and protein status. So do they have enough? Where are they getting it from? Their overall nutritional intake. And then maybe some of the other vitamins that are associated with hair, and that includes vitamin A and inositol, B6, folate, and then some of my fatty acids. So that might be, as a dietitian, looking at kind of the nutrient sense of what they're doing food-wise. Does it include those things? But then also, how is that looked at for their vitamins and minerals? So kind of categorize this out. So treatment, what I'm really looking at in terms of numbers here. So, is their iron adequate? Is it included in their multivitamin or their bariatric multivitamin? Do we have the other kind of nuances here of zinc and maybe biotin? And what I'll say is, like, my quick note on biotin, a lot of people will take that and try to take extra of that in order for hair growth. I don't see that always correlating because a lot of our biotin is made by our gut bacteria and microbiome. So, and it usually creates enough to have and meet our overall needs. And if they have a robust multivitamin, biotin might be included in that in the correct amount. So I'm usually always kind of checking my bases of that big picture in here as well. So, and they really just might also be in that like really tough time where it's that like 3 months after surgery, but before 6 or 7 months post surgery, that they just might have that thinning of hair. But this at least can kind of help you or help guide you of like, oh, do we need to additionally supplement here for a little bit? Or do we need to take a look at someone's multivitamin use and consistency and even what they're using? This just comes up a lot in my practice, so I wanted to share at least what to do with this. So that could maybe potentially help you if you're seeing a patient or a client during this time. So let's talk micronutrients. I know I talked a little bit about them, but I actually wanted to take a look at just on a cellular level with micronutrient testing. I with some of my clients, I use an actual micronutrient testing from SpectraCell. And why I might utilize that more than just their blood work, maybe their blood work isn't looking at every single nutrient. And if someone is feeling really sluggish and lack of energy and potentially lack of weight loss, I might want to take a closer look cellular level and just evaluate the nutrients within that cell. So some of the measures that I look for are some of my actual vitamins, minerals, but I'm also thinking too, for example, like oleic acid, it takes a look at that. And that is actually what facilitates vitamin A absorption from the gut. So do I actually just need to look at some of my other factors that may have a difficulty with helping maintain these levels within someone? So another kind of thing that I think about too is if someone has, let's say they get blood work and they consistently have a low vitamin A, and that's not really, coming up. So the other thing that I think through is, oh, maybe I do need to look at it cellularly to just get to the bottom of things so that I have the support for vitamin A to actually be absorbed or used. And so here's just a quick example of just some of the numbers of what this will look at or look for. But if I'm kind of seeing this, what do I usually see, or what is my interpretation? So some of the things I think through is maybe doing a supplement of a separate B complex along with what they have. Inositol, I do think about a separate magnesium. Fullscript has quite a few really lovely magnesium glycinate forms and formulations. So I might think of that for not only just like calming and relaxing of the nervous system. I might think of that with women with like PCOS or with some hormonal issues that also may still appear after bariatric surgery. I also put the oleic acid vitamin A part 2 because I'm really trying to get, that's a tricky one, and I'm trying to get to the bottom of it. And do I need to supplement with a vitamin A or a certain form of retinol? Or am I really looking at kind of the carrier, or even a retinol binding protein that's often seen difficult in carrying iron? So you might see a vitamin A and an iron connection depletion. So just, I'm getting in the weeds here, but I always love to talk through this because I think it's so helpful to know that there could be really, really more insight to this picture than just surgery itself. And then lastly, I want to take a look at gut health and gut microbial health, because this, I definitely am seeing this come up more and more and more in my practice. And over the years, just seeing so many people go through surgery, that I see this come about as people get further out from their surgical procedure. So one, I would just say that I typically look at how their gut itself, or how their digestion status is before surgery. So if I'm lucky enough to be with someone throughout their whole entire process, I want to question, hey, how are they feeling? How do they feel digestively? Do they have a lot of bloating? Do they have a lot of pain? And do I need to look at that or address that before they even like before surgery? So that might include like that probiotic, prebiotic, Saccharomyces boulardii. If it's something a little bit more, if they've had past H. pylori or SIBO, is that fully addressed? So there's a couple things I can look at there. And then even after surgery, if we just think of that, like shaking up that house and plopping it down, if we think of that scenario, then I'm almost thinking like, oh gosh, do I have a gut dysbiosis going on? That's kind of also feeling like a little bit of leaky gut, and just wanting to explore that a little bit more with them. So what do we see surgery wise in terms of gut dysbiosis or even gut microbiome? So we do see with surgery and some medical conditions, and even environment and lifestyle, and let's say if I typically see it with a lot of like less kind of vegetable intake, more packaged food intake. And I'm not even talking about, what someone would quote unquote consider unhealthy packaged food. Just I see that, our let's say our microbiome isn't being fed properly, then I'll start seeing that imbalance. And so one thing that I do use to personalize my supplementation with addressing this, I'll use the like a microbiome test. I put an example up here from GI Map. And so I'm looking at my gut microbiome and what do I need to use or potentially address within their gut microbiome. So is that dysbiosis? Is that H. pylori? Is that a phyla imbalance, or just their immune function? So this is a little bit of an example of what you may see. This is just taking a look at opportunistic or overgrowth bacteria. And so I do see this actually quite commonly after bariatric surgery. And so what I might use for this is maybe a general antimicrobial that includes like wormwood and artemisium. I tend to use like a GI Microbex from Designs for Health, something of that's available through Fullscript to be able to help someone rebalance this gut dysbiosis. And so what I can say, standardly, most people are looking at microbiome. They're looking at like, hey, let's make fiber happen. Let's make sure there's prebiotics, probiotics. They might throw in a synbiotic, which is kind of a combo of both. And then maybe even thinking about like what they call kind of like a postbiotic, or what happens or what comes out. So that's standardly what's thought of. And whenever I approach supplementation and gut health, I'm really trying to figure out, like, am I trying to rebalance something? Am I trying to address like an H. pylori, or utilizing like a phage, like a macrophage, which may be utilized with a parasite. And so I think fluorosist with phage technology, that's kind of what the label says. But basically that one utilizes for like a parasite, or yeah, mostly I'm using them with parasites. That is something that's actually quite effective on just addressing that parasite itself. It's kind of like a small virus that opens up and attacks that parasite, but then also utilizes some of the probiotics too, like lactobacillus, to help even out that picture and kind of grow in for that gut lining wall. So things that I look at, I am looking at nutrition, fiber, maybe a fiber supplement, but I'm hoping to get it from food, maybe fermentation. Also looking at stress, physical activity, sleep. So that's where maybe my sleep aids may come in. And then I also do look at prebiotics, probiotics, and that Saccharomyces boulardii. And so usually, as I said, I want a multi-strain probiotic, and I'm hoping to try to take a look at, like, for my Saccharomyces boulardii, if that's included or if I need to use that separately. And then kind of my interpretation of my GI map. Maybe I'm looking at like what's usually seen with bariatric surgery. So I usually see H. pylori, that's pretty common. It's in about 50 to 60% of the population. So I oftentimes see that. And maybe I'll want to use a mastic gum and a DGL combination for H. pylori versus antibiotics. I also may see dysbiosis. So with that, I am looking at like grapefruit seed extract, sweet wormwood. Artemisium is one that oftentimes I'm used, and that's why I kind of will use like a combo product. And then also low secretory IgA, which is that immune barrier in that wall. So oftentimes people will say like, oh, my stomach just kind of bothers me, but it's real hit or miss. And so it's not like when I eat, insert food there, peppers, my stomach hurts. It's kind of all the time it feels really off. And so that might be with that immune barrier, needing to be kind of really robust, like bouncers to their own personal club, to be able to make decisions on whether that absorption part can happen. And I always look at gut health with absorption, because that also includes vitamins and mineral absorption too. So with that secretory IgA, I may think of an immunoglobulin. So like IgG Protect from Orthomolecular. Again, maybe my Saccharomyces boulardii, which I usually use like Floromyces from Designs for Health for that one. So a couple of things that all available through Fullscript on just being able to customize this a little bit more robustly for your client that goes through bariatric surgery, because definitely surgery is one day and then everything happens still afterwards. So if I'm looking at my lifelong working with my clients, I want to be able to address all of the different things that come up so they can have the most energetic, robust lives that they can have possible. So what I would say, just to kind of review and remember, is metabolic bariatric surgery, it's complex. It has anatomical changes, physiological changes. And so I want to think through that as approaching someone with that in their history. Case by case basis. I want to use a supplementation of what's going to make sense. And maybe I'm going to say, like, we're focusing on gut health right now. We're focusing on sleep assistance right now, and really find that pairing that works. And then also looking at the other, if there's testing that is needed, and maybe I'm going to address based upon testing to just further someone's health overall after surgery. So in conclusion, I think I have enough time for some questions, and hopefully I have some answers. But I want to thank Fullscript for allowing me this opportunity to just really try to cover so many bases in a complex subject, but a really enjoyable subject. So I do have my information up here for you guys, and I'll leave that up here, but I'm gonna switch it back over so I can answer any questions that I can.
Yes, great. Thank you very much. There are definitely a few questions coming through, and I will say this is being recorded, so we'll try to answer as many as we can and send out the recording. But if we don't get to them all, as Katie has here, you can reach out to her. You can reach out to Fullscript. Webinars@fullscript.com is my, or the email that I have that I can help with. So reach out to us, but let's jump in. So you'll have to bear with me as even more coming through. But one of the first ones that came through is, when you're supplementing B vitamins post-bariatric surgery, do you worry about methylated versions, or is it a case specific?
So I do worry about methylated versions, and especially if I can get a methylated version, I think about that. The other thing I think about, just to throw this in for B complex, is, not all of them are made the same. There is probably a concern, or at least a more concern for me right after bariatric surgery, of someone having a thiamine deficiency, which is B1. So I'm wanting to make sure that my B complex includes at least 12 milligrams of B1. And so that way, that kind of covers my base there. And then I do want methylated for just my more of my ease of making sure that their absorption is going to be well tolerated after surgery.
There was a second part of that question too.
Okay.
You might have to forgive me if I pronounce things wrong, but do you worry about MTHFR mutation?
Okay. Yeah. So you did great. Yes. So do I worry about that? I think I definitely think through that, but I don't worry about it as much. And the only reason why I say that is that I'm wanting to make sure my bases are covered for all of my vitamins and minerals. And then if that mutation comes up and I have to think through folate differently, I can.
Mm.
So, so off the bat, I'm not like, oh my gosh, so micromanaged on that. But let's say, like, obviously it will come up if that's part of their picture. Yeah.
Yeah. Let's see. So the next one we have, is there an increased risk of SIBO post-bariatric surgery?
There is. So
Yeah.
SIBO, small intestinal bacterial overgrowth. And so with SIBO, we usually see an increased prevalence of about, I want to say, oh gosh, I did look this up. I want to say it's 47% after surgery. So more of a prevalence of that happening after surgery. So that's why I think in terms of when I was talking about gut health, and I'm like, yeah, I just see it more and more with someone after surgery and usually years out after surgery. I also like to know if they had SIBO before surgery, because that just adds a whole other part of this. But I'm wanting to make sure that, gosh, knowing that prevalence and knowing that it occurs, if someone is having stalls in weight loss, if they're having bloating, and what probably my most, like, if I think through, I ask for bloating, like, do you bloat after each meal and it like goes up and down, or is it like a dial? So let's say you like bloating, you're fine in the morning and then bloating gets worse throughout the day. That's usually much more of a sign of gut dysbiosis or potential SIBO. And then from there, do I want to test them, or do I want to kind of just look at their microbiome as a whole? So, but we do see it more after surgery. Yeah.
I have a couple more specific kind of questions I'll probably move into, and more like specific kind of recommendations or
Yeah.
kind of clients that or patients that they're seeing. So one is about the protein intake. So this
Oh,
one is probably a multi question too, but I'll start slow. How
yeah.
does the intake of 80 to 100 GM of protein work out in a client with reduced ability to absorb amino acids?
Okay. So, well, so I guess a couple things. So with their reduced absorption of amino acids, oftentimes, like if I'm just looking at bariatric surgery, why I want higher doses of things is because I want more opportunity of the little bit of absorption that I have left. I want to guarantee that things are going to go through the door. So oftentimes I have more of that amount available in there. When it comes to protein supplementation, I also want to make sure that it's a complete protein and it's not missing any of my essential amino acids that my body doesn't create. So it comes from my protein supplement. And then 80 to 100 grams, that was from the telogen effluvium slide. And so that's, with protein needs, I'm adjusting them for each and every one of my clients. Like I'm figuring that out for them. So 80 to 100, I was like, oh, that's in general, but making sure that my protein kind of needs are marked off. So I think when I'm looking at that, like, hey, how does that happen? Or how does that guarantee? Like, it's not that our body doesn't absorb things, but what I can, I guess, say or think through is that, like, when you have your digestive tract, like, not everything that we put in our body automatically absorbs. So sometimes we're just wanting also more opportunity to be like, we have so much opportunity for it to absorb, for that, like for it to go through that door. So I don't know if I exactly answered that question, but I'm trying to at least be like, okay, let's visualize this together. So reach
Yeah,
out to me if
no.
I didn't answer it.
Yeah, and that's perfect. That's we only have so much time for questions. I'm sure we could talk all day. So
Yeah,
I think if you have your, contact there, people can reach out. Audiences
please.
will get the follow-up and maybe rewatch and find some answers too. So
Yeah.
um I have a couple, yeah, still not kind of specific recommendation questions. There was a question that came in. What supplements would you recommend for dumping syndrome?
Ooh, okay. So dumping's tough. So there's going to be like like late dumping or more immediate dumping, and that's usually if there's so much of a usually high carbohydrate or high sugar or high fat load that our body's just like abort mission, and it dumps it into the small intestines and gets it out of the body. So if I'm looking at that, and if someone's having dumping or frequent dumping, on the front end, I'm going to maybe look at, like, how are they eating, how much at one time, how frequent. So are we going from like not eating for a long time and then all of a sudden eating? And then that's going to put a lot of pressure. So that's just like one part, non-supplemental. My other part of this picture would probably be like, oh, supplemental wise, I would look at like insulin resistance. So I probably would lean towards like an inositol to help with that. But I definitely would look at food too. Yeah.
Okay, that's interesting actually, and I also just learned something new. I did not know what that was, so thank you.
No
um,
problem.
Another question on probiotic. Is there a particular multi-strain probiotic that you use regularly or more often? And is there a CFU you aim for?
Okay. Great question. Because I know I didn't look at that. Like so I like Therabiotic by Claire Labs. I like that as a multi-strain kind of one. It doesn't include Saccharomyces boulardii, so I oftentimes do that separately. If I'm trying to do Saccharomyces boulardii. And so that's probably my most, like, let's say, used one in terms of probiotics. I'm going through this catalog in my head of like, okay, what do I use in Fullscript? What clients have I used different things with? Um, and then for Saccharomyces boulardii, I usually use Floromyces by Designs for Health. I get the most tolerance with that one, and that sounds really weird, but for some reason I've tried others, and sometimes people will say like, oh, I get a little bloated, or and I don't know why, but that's where I use that one. And then let's see, CFU. So I am looking if it's a multi-strain. I don't necessarily have a CFU that I'm typically like aiming for. Um, I'm usually looking I'm most of the time looking for like under because I also don't want to, if I'm trying to rebalance something, then I also don't want to like throw too many things into the party all at once. So if I'm looking at that, then I'm probably looking under 30 billion CFU. So it's a pretty high number, but I'm just making sure to cover my bases. Yeah.
That's great. A question about turmeric.
Mm-hmm.
So if someone had an IgG test and turmeric was a source of inflammation, is there anything else that they could use?
So, so if turmeric on their IgG, and if you're just staying, yeah, if they're not doing turmeric, what I might use is I might use the boswellia, and I would do that just separate, actually, because that's also really anti-inflammatory as well. So that's probably where I would end up just being like, oh, no turmeric, and then, or no curcumin, and then going towards that. The other thing too is if they're not high, let's say, on that IgG test, then I'm wondering if it's turmeric or if they're doing like a pharmaceutical, like a curcumin pharmaceutical grade, like in a supplement, they might be okay with that. But honestly, I just do the boswellia.
Mm-hmm. This next one is kind of like a multi question, and it's a couple questions come through, so I'm kind of combining them. But it's basically on, the type of supplements you would take. So there was a question, people have heard that you should only have liquid vitamins or herbs. This one question is, what are your opinion on skin patch vitamins and minerals? Do you have any preferences, versus the capsule kind?
I do. And just because most of your vitamins and minerals don't necessarily absorb transdermally. Some do, but most of them don't. So then I'm kind of picky of like, all right, if you're just doing like one patch vitamin, does that absorb through your skin? That's an easy answer, yes or no. When you start looking at like, hey, this is a multivitamin that absorbs through your skin, and like, not all of them are going to be able to absorb. So I actually don't prefer them just because of that reason. And I haven't found, I mean, I'm always open to new science, love it, but I haven't found any confirming evidence of something new or different that confirms that for me. So I'll take a look at a capsule, I'll take a look at a liquid, is there a preference? Honestly, because people have to be on stuff for life, I am like, what will you take? That is really like great. Ideally, in the most perfect world, I probably would be like, this I would have powder, this I would have liquid, blah, blah, blah. But honestly, after doing this for so long, I'm always like, what do you prefer? Let's see if we can match that up. So that way it's, I have someone taking what they need to have.
Yeah, and easier to stick with,
Yeah,
adhere to what they
exactly.
have. Yeah, that makes sense.
Yeah,
I'm conscious of time, but there's one more question I'll ask you, and then
sure.
if there's any more or anything that we really didn't get to, we can reach out to either me or Katie. But the last kind of question was that you covered a lot of post-bariatric nutrition. Do you
Mhm.
have any recommendations for pre-bariatric surgery going into it?
Sure. So pre-bariatric surgery, I am looking for a couple things. So, one, I can say a lot of times surgeons or surgical centers have like, hey, this is the pre-bariatric, what I want you to cover in terms of how they're eating. And that might be like months before surgery or 2 weeks before surgery. So I'm conscious of that. If I'm looking at like, what am I trying to do? I'm trying to control blood sugars. I want them to have the safest, most best surgery. So
Hmm.
control blood sugars, make sure their iron status is okay, make sure that their protein status is okay for wound healing, along with vitamin C and zinc. So I oftentimes supplement wise will go like, oh, I want a really well-rounded multivitamin. And then also at the same time, do I need to work on insulin? So again, inositol, omega-3 fatty acids come up for me. Um, Inflammation might come up as
Hmm.
well. And then I think my kind of maybe last thing that I do pre-surgery as well is gut health, because it's only going to change more after surgery. So if something's really happening, and I kind of get all up in everyone's business of like bowel movements and all of that stuff before surgery, but it just
Definitely.
helps for me, right? Yeah, it helps for me to assess like, is something really happening? And so depending on how long I get with someone pre-surgery, and that's why I probably spoke more post-surgery, because more people think like, oh, I had surgery, now I want to make sure. And so a lot of times people are with me longer post-surgery than they are pre-surgery. But if
Yeah.
I get that opportunity, then those are the things that I think through and look for. Yeah.
Yeah, no, that definitely makes sense. And I am conscious of time. I know we're a couple minutes or almost at just a little over an hour, but another quick reminder, this is being recorded, so you'll get a copy. It'll live on Fullscript's website. And with the copy, I believe, correct me if I'm wrong, we can send slides or some sort of slides with it as well, that you've shared here today.
Yeah.
Yes, so you'll get those and any resources we
Yeah.
can pass along as well. But I want to thank you, Katie, for being here with us today. What a
Yeah.
great, valuable webinar we've had, and we hope to have you again in the future.
Yeah, absolutely. But we could talk forever
Yeah.
about all the things. So thank you for having me. I've had so much fun.
Yes, well, I agree. We could talk forever, but I will let everyone go and enjoy the rest of their day and keep an eye on your inbox for the follow-up and recording.
Thank you.
All right, thanks. Bye.
Bye-bye.